I'm Dr. Courtney Howard. I'm an emergency doctor in Chief Drag East Territory in the Canadian subarctic. I was a new doctor in Inuvik, north of the Arctic Circle, when I read in 2009 in the Lancet that climate change is the biggest global health threat of the 21st century. I was surprised, but my patients weren't. They would say things like, I was crossing a river on my snow machine. The ice is usually stable at that time of year, but I went through. It's making it more difficult to access traditional foods, leading to mental health challenges, food security challenges. And people will say things like, if it's this bad now, what does this mean for our kids? That part of the world is already coping with temperatures 3 degrees Celsius warmer than when an 80-year-old elder was born. In 2014, as an emergency doctor in Yellowknife in the subarctic, I saw asthma exacerbation after asthma exacerbation during wildfire season. We had 2.5 months of wildfires that resulted in one of the worst urban smoke exposures in the literature base. We saw a doubling of emergency department visits for asthma, 50% increase in visits for pneumonia, and one of our pharmacies ran out of breathing medications. We also found that people got sad living in the midst of smoke, and Indigenous patients told me that they found it more difficult to connect with the land. And that connection with the land is something I have really taken from working with the majority Indigenous population. Fundamentally, solving our climate crisis is going to mean recognizing that our health depends on the health of the planet. I have learned a lot about climate change and health from the Lancet. I think I've learned as much and in a very different way from my Indigenous patients. And so I, as a doctor, knowing that part of my responsibility is to advocate for healthy public policy on behalf of my patients, started working with the Canadian Association of Physicians from the Environment and the Canadian Medical Association to lend the voice of health to efforts to phase out coal-fired power, to institute a federal price on carbon, helping people remember that if we decrease air pollution, we keep people out of the emergency department and save healthcare costs right now. This work has been incredibly rewarding, has helped me feel like I'm serving my patient population, and I look forward to seeing what we can do together this year.